Believe it or not, we had an earthquake in Maryland today.
Mhm.
More, I felt it, but I didn't know it was a earthquake
Wow.
today,
Hmm.
but it was small. And it wasn't the magnitude you have in California, but it happened. So again, things are happening. It's the end times. So welcome. Welcome to Medical Mondays with Dr. O. I hope you all have had a wonderful day. I am Dr. Tonyo Kwesomi. I'm a family practitioner, HIV specialist, and I treat addictions. I treat everyone. I was also trained to deliver babies. I don't think I ever told you that. So I can deliver babies. I will if I have to, but I stopped delivering babies years ago because babies don't tell you when they're coming. And I decided, okay, we'll move on from that. So I treat from babies to any age and any disease entity that comes through the door. And I'm grateful for the training because it accords me the opportunity to be able to look at every sphere of medicine and life. This month, though, is Domestic Violence Month, and we are focused on domestic violence because it's real in our community, whether we want to believe it or not. We have many people going through domestic violence and they don't talk about it because that's what it's about. It's part of what it's about, is what I should say. They suppressed while they're being abused, and most don't talk. But we thank God that last year, when we observed domestic violence, we had a lot of people going through that came out, and the Lord intervened in many of their lives. And we're grateful for that in all of their lives, actually. And tonight, we are privileged to have one of ours, family, family, one of our family on Medical Mondays with Dr. O, who is actually also, she's somebody who has gone through domestic violence. She's a survivor, but also, or I should say, and also a conqueror. So, without much ado, I'm going to yield the floor to our very own Counselor Aramide. Where is she? She was here. She actually took the experience she had to go into counseling so that she's now helping others to overcome and to thrive. Um, I remember a story like yesterday. She endured domestic violence as a child. She has a scar on her face still today that she that was sustained when she was a child, and then she got married and another domestic violence situation. So, without much ado, Aramide, please come on and take over. Counselor Aramide Adedeji, welcome.
Good evening, everyone. Thank you, Dr. O, for the privilege to meet with everyone. I kicked off my speaking career on Medical Mondays last year, so I want to thank Dr. O for the opportunity that you afforded me last year and bringing me back again to speak to everyone. I hope everyone is doing well. And as Dr. O said, this is Domestic Violence Awareness Month. And really, I would say every month is Domestic Violence Awareness Month because the people who are experiencing domestic violence, they're experiencing it every day of every month. So it is important for all of us to be hypervigilant and aware of what's happening in our communities and in our families and around us. So I presented last year in full detail about my story. Tonight I will inject some of that into my presentation today, but I won't focus fully on my story, but you'll hear parts of it as it permits as I speak. But what I want to focus on is one of the chapters of my book. I wanted to share with everyone who does not know on this call that I did write a book. And the book is called A Whole New World. And it basically talks about the strategies that I used to heal from being a survivor of intimate partner violence. And intimate partner violence and domestic violence, they are used interchangeably, but specifically domestic violence, as Dr. O mentioned, that can be with anyone that you live with. That could be a parent to a child to a parent. It could be siblings. It could be anybody that you live with that doesn't necessarily mean an intimate partner. But intimate partner violence, IPV for short, is when they are romantically involved. And I was in both. I was in domestic violence as a child, and I grew up, and as an adult, I experienced IPV. So I people use that interchangeably, and I might in this presentation, but just helping y'all understand what the difference is. Today, I want to talk about why time does not heal, but healing heals. I want to really emphasize that because as a counselor and therapist, as Dr. O mentioned, I have 16 going on 17 years of experience of working with different clients dealing with depression, anxiety, um, major depressive disorders, things like that. And they do not connect the dots of experiencing domestic violence. And so when I'm talking to them and I'm asking them about childhood experiences and asking them about their relationships, then it comes out, oh, I never knew it was called that. Or, I heard about that. And I think that, that person who experienced that's not really what I'm experiencing. Or I have people who would say, this happened a long time ago and I've worked my way through it. And, some people have had other relationships, new partners, new marriages, but because they did not take the intentionality that it takes for the healing, because they did not do that part, they find that those wounds are unhealed. So I just wanted to preface what I'm going to share on my screen in a moment to let y'all know that the healing aspect has to be intentional. If you do not have the specific thought and support and wherewithal to say, I want to heal from what I experienced. It's just like anything. If you have a car accident or you have a broken bone somewhere and you say, "Oh, you know what? All I have to do is stay off of it for God knows how long," and that should eventually heal this broken bone. No, on this call that just won't be the case. You have to be deliberate about all of the process that is going to take to mend the bone. And some people go to physical therapy, some people need to go to mental health therapy to just heal through what they went through. It's the same thing with intimate partner violence. You have to be intentional. So I'm going to share my screen really quickly, and I'm going to go through some things. And like I said, I will share my story as it permits. Oh, it says host disabled participant screen sharing. If you can give me access, Dr. O. Do I have access? Okay, yes, I do. Okay. Okay, can everybody see the screen?
Yes, I'm
Okay,
muted and I'm talking. I'm sorry. Sorry about that.
no problem. Everybody can see the screen?
Yes, we
All
see
right,
it.
wonderful. Okay. So, as I shared, healing, not time. I have a chapter in my book called Healing Heals All Wounds. And that basically speaks to the intentionality of what each and every one of us takes time to do, what we find to be important. And when we experience traumatic things, such as our emotional and mental and physical spaces being violated, then we have to do the work to get us back to where we feel healthy in each and every one of those areas. As I say on this title, time alone does not heal what intention refuses to face. And one of the things that I find as I talk to people ever since I wrote my book, but also since I've been a therapist, is that when people do not acknowledge that something was traumatic, then it remains a part of your life very actively, um, which means that different things would trigger people. You know, you might hear a voice. A lot of times I have clients who hear, smell, see things. I remember when I had ended my relationship with my abuser. Finally, he was out of my life, and I was a therapist and social worker in a foster care agency. And one of the dads, I could not shake it. This man looked like my abuser, but 10 years later. So, like, my abuser was maybe 25, 28 at the time when I was experiencing abuse. This guy, this client of mine, her dad, I would give him 15 years older than that, but he looked exactly like my abuser, and we just did not get along. And he didn't like me, I didn't like him. We were triggering each other, and I could not. And I kept asking myself, why does he look like this guy so much? But his behavior was similar to him too. So we just triggered each other, and he refused to work with me. There were some things that I would need him to sign. He would refuse to come, and then we had to get my manager at the time to intervene, and she was just asking me, "What is your problem with this guy?" And I just could not explain it, but I understood that I was just very triggered. Then that was earlier on, so I hadn't done the work of healing through that abuse. And that man just looked like him. I could not shake it until I was off that case. We never got along. It just went like that. But different clients, they're triggered by different things, scents, seeing um, certain things. For me, when my abuser almost took my life, we were in Las Vegas. And it took me a long time to go back to Las Vegas. And I remember the first time my cousin decided that she wanted to rewrite history and just give me a new memory. And so she was like, we are going, I think maybe 2 or 3 years later, we're going to Vegas. We're going to create a new memory for you for Vegas. And my cousin, a cousin was coming along with us. And, I had suppressed the name of the hotel that we stayed at for so long. But as soon as my cousin booked rooms in that hotel, it came back just like that. And I started to feel strong feelings. So that tells me of myself at that time that I had not healed. I even remember the number of the room number that we stayed in and all of that. As soon as that hotel's name was brought up, and there's a billion and one hotels in Las Vegas. So how in the world would I remember? But I was very hyper vigilant and I did not want to stay in that hotel. So there is intentionality that comes from healing from the things that we've gone through, especially with a traumatic experience like domestic violence. And the myth, a lot of people have this myth. I won't just say our African brothers and sisters, but I think everyone kind of has this feeling. If I spend a lot of time away from the situation, that everything will be fine. Time passes, it'll be fine. Some people I met at another event, I met somebody who works with families who want to have children but are having infertility issues. And I was just chatting with her because my table was next to hers, and she said, "Oh, I have a client that wrote that she was a domestic violence survivor on her application, but." But even the lady that I was talking to, she was like, "Oh, but that was 20 years ago. She's totally fine. She just kind of wrote it on her application." And I said, "But do you have a question that's related to domestic violence? Because obviously if the questions was related to have you ever experienced trauma, or I don't know what the question was, but the point is that that person, that client of hers, felt the need to write that 20-year-old trauma on her application. And that tells me that she really hasn't healed from it. She hasn't done, she's married now and trying to have a baby with someone else, but that does not mean that she's done the work to heal. And so I talked to that lady about connecting me with her if need be, and so that I can support if they needed that help. But the whole point is that time itself, without the intentionality of the work of healing, will remain. It'll just air its head in different ways. The trauma would come through in different ways, and people find their ways to suppress it. So it has to be addressed in different forms, and I'll talk about the different forms. Um, Healing is not passive, it is a deliberate act. I want to restore, I want to feel better. For me, after experiencing what I um, experienced in Vegas, which is mainly my abuser who I had been with for a year, basically got to a point where I would assume he had been holding himself back from the physical abuse. I had been experiencing the verbal and the psychological and the mental abuse, but he had held himself back from the physical side. And once we were in Las Vegas and he was very angry with me, um, he put his hand around my neck, pulled me by my braids, did all kind of atrocities to me. And it took a while for me to even forgive the fact that I allowed myself to go through that. Of course, I did not connect the dots from childhood and all of that. But it took a long time because I always was one that was vocal. I would never stay with someone who would do that. I wish he would. I da 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 da. I had a whole 2 hour argument with my best friend. I can't believe she would and all that. So I had to deal with the guilt of, well, yeah, you actually did allow that. And so part of the healing process was to forgive myself, to say, hey, there were some precursors, there was some predisposition situations and traumas that occurred that allowed you and made you susceptible to be in an abusive relationship later on, but that only came from a deliberate act. And of course, this also came after me saying, well, I've lost everything. I've lost family. One of my best friends, his wedding was coming up, and my abuser manipulated me out of going to that wedding. And so him and my friendship was over. And just a lot of things that I felt I needed to pick up after leaving this person. And I just wanted to give up, and I just said, God, just take me. I don't, I can't do it. I don't have the ability to do it, but just take me. Just make me not wake up. And I don't want to do this. But again, as people started to come back into my life little by little, I took deliberate intention at restoring myself, restoring my life, restoring friendships. Of course, some don't stay the same, but you gain new ones, or old ones become even more refined because now you can talk about what you went through. When, usually statistically, abusers, they one of their tactics is to pull you away from support systems. So now that you are intentionally trying to connect with those people that was once in your life, then there's a little more freedom to talk about what you went through without shame and guilt. And so, just to really speak to, because a lot of times, and I can speak to this as a Nigerian woman and listening to other, not only Nigerian, but African women, where the the f- the idea of only physical abuse, um, and what people feel they can handle happens through those conversations. Well, he's never put hands on me, but then he puts you down every chance he gets, or she puts you down whenever she can, or um, psychologically you are being manipulated and twisted. And in my longer presentation that I have given to people, I talk about the different forms of the abuse, such as gaslighting, and that's not anything that is physical, but it's still emotional and mental abuse, where someone is gaslighting you and making you feel crazy, that your thoughts are just crazy, and the way that you saw something, even though you are a very intelligent person, they're twisting it and making you feel like you're the one that's abnormal and everyone else, especially him, is normal. And I just want to preface by saying that men are also victims. I think Dr. O mentioned that last week. And so the same tactics take place with they may not experience as much physical, but they are experiencing the mental, the emotional, the manipulation, the gaslighting, all of those type of things. But the invisible scars exist because your body is doing something. Your brain is telling you danger, danger. You're on here it says belief system, but I want to talk about the body again. I'll say for me, even though I claimed to be in a loving relationship, as I shared with my family, no, we love each other, and no, he's good, he's that. But I can tell you that every time that I was around him, I my body was always tense, because there was no idea how the day or the night might turn. We could be having a chat like I'm chatting with you guys right now, and then there's something that's said, there's a face that he makes, and then the whole night is thrown in the toilet because I have no idea what just happened. And then in asking him what just happened, he's like, "Oh, you don't know?" And I'm sitting there and I'm like a child again. I don't know. Can you help me? And then everything is just upside down. And he's calling me out my name. He's telling me all kind of awful things. So my body was always tense. My brain was always on alert, always thinking how I hope today would be great. I'll be counting how many good days we have in a row. If I'm doing all that, what do you think my whole rest of my life looked like? It was just always on alert. I was hyper vigilant. I was always thinking the next move and how to please him and how to do this and how to do that. And maybe if I do this, and maybe, like he said, just shut up sometimes. Maybe if I do that, um, you know, then things will be better. But it never was better. It never was. And then the belief system side of things, when they start challenging your belief system. Well, this is what family means to me. Well, that's stupid. That's dumb. Or your faith. Well, this is how we pray. This is how I grew up praying. Well, I mean, prayer is fine, but there was always something being challenged, and then you are, I'll say, at least for me, I felt guilty because there's a way that I was taught about my belief system, the values, and that was always challenged. And then I sat back and felt so guilty that I allowed his belief system to kind of color mine. And so those are the invisible scars. This is, like I said, Vegas was almost, I want to say, a year of our relationship. That happened a year in. So I had already experienced all of these other things: the challenging of the belief system, the body being tense, the brain always actively working, the hypervigilance, the guilt, the shame, the all of that happened within the year before he even laid hands on me. And that's what I try to explain to people, that the invisible scars are absolutely scars nonetheless. And so they need to be healed. They need to be understood that they exist so that we can heal. Um, and then, of course, then we talk about the emotional and the psychological, you challenging your very beliefs that you've had all your life, and all of a sudden someone comes in and says, "Well, that's stupid," and then you're like, "Well, wow, is it stupid?" Or okay, and then you start doing something else that you feel in your heart of hearts, you know something isn't right, but in order to just kind of go along to get along, you do them. And um and so so those are some of the invisible scars. Let me keep uh next. I can't change the slide. There we go. All right. um okay, so what usually is happening, and I can speak from this experience, survival mode, as I just spoke about. In order to preserve the relationship, I was always thinking each and every day, how do I make sure that the relationship is intact and we stay together and we're happy. And I shared last year, and I share when I do presentations with people, that as a Nigerian woman, and he was also is, I shouldn't say was, because I don't think he's passed away, and I don't wish that on him actually, but I don't know where he is. But he's half Nigerian, half American, and but he mostly grew up with his American mother. But his dad was influential in his life because he definitely adopted some ideology from an African parent. And but he understood from my standpoint that I wanted, some basic things that are, I won't say every, but most young ladies want. I want to be married one day. I want to have kids one day. I want to, all these things. And my survival mode involved me wanting to pursue that. So even though, yeah, he's not always nice to me, he's not always this. And if I remember, and I can be honest now without shame, my younger sister, who's 4 years younger than me, was pretty much preparing to be married. There, she was courting her now husband. They've been married 16 years, and she was courting him at that time. 4 years younger than me. There was a lot of shame around. You don't have anybody yet. What's going on with that? So I just looked at the person that I was with. No, it's not great, but it's a body. It's a human person. I can present him as well, and that my survival mode involved me trying to keep that, to make sure that I also had someone and all that. And I can also, get married one day. And he absolutely dangled that almost every day, if not every hour, just dangling, if you behave, you'll get married one day. Just behave. And so I would put myself in survival mode almost every day, just trying to make sure, well, yeah, okay, if I just behave. But the whole point is, what I make sure people understand when I do the trainings or I'm talking to my clients, is that the viewpoint of the abuser is to maintain control, and that is it. It is not because he drank too much, or she just had some kind of issue, or whatever. And if I can just make sure that he doesn't drink or he doesn't abuse drugs and all of that, that all those behaviors won't happen. And that's just not, that's a myth, that it's because, and he just needs to control anger. That's a myth. It is not about anger, it's about the power and control aspect. And so for him, he understood that there was something that I wanted since I was 6 years old, which was to, be a mom one day. But yeah, get married, but I want to be a mom one day. And so he would dangle that every time. I will give you your baby, just behave. If you would just behave, if you keep on like that, you'll be a 30-year-old spinster. You'll be a 35-year-old spinster. He would say that all the time. And then I would go back and be like, okay, all right, what do I do? How do I behave better and all that? And so survival mode keeps you alive. You're able to stay in the relationship. You're maintaining it somehow. And of course, you're maintaining it by not listening to your body, to your, as I shared in the last slide, you're not listening to any of those. Because if anybody by the mere thought of them makes your body tense up, then that's something that you need to look into. That's a problem. Um, and so when you are in the healing space, you understand that, hey, I don't want to be in survival mode. I want to heal. I want to feel all the feelings. And sometimes that means that I don't feel so great. That means I feel empowered. That means um, today my story, even though it's mine and it's empowering, it sounds very ugly. That means all of the ranges of feelings. I remember a year ago in promoting my book, and I was on a Zoom call, and I realized on the call that there was parts of my story with this man that I had suppressed. And in that moment, God brought an example up based just like I'm talking right now, and an example that I had forgotten for 17 years came up, and I started to cry on the call. And I was so apologetic, and I was like, oh dear, this is unprofessional. And they were just so kind and was like, oh my goodness, we're all here to support. But I was the presenter, and I was in tears because I had suppressed a lot of the things that I had gone through. And that has been part of the healing process, which will take place. And of course, I've put myself out here now, and I have a book, and I'm doing presentations. So, it just depends on the day. You just are, gonna feel a range of things. And so, but that's part of the healing, and that's okay, which helps you live again because I can share the story, hear someone else, and not fall apart and not say, oh no, I can't do this. No, every time that I do a presentation like this, I feel even more empowered that I need to keep going, and God is my strength to do so. But again, this comes to our next point, which is that healing begins with awareness. Something awful happened to me. If we cannot say those words, then you are not in the healing process yet. You are still surviving, and that could be a 20-year survival. Let's just be honest. That could be a 30-year survival. But without awareness, you are in that space. But healing is saying something awful happened to me and it should not have. Also, healing starts with understanding what do I need to do, especially if someone is actively in that space, really identifying what are the safety plans, what do I need, who do I need to call. On a lot of the calls that I have, people ask me, well, what do I do for someone that doesn't want to leave? I'm like, you can't do anything about them not wanting to leave. But what you can do is be there for them and let them know that because they've decided on this relationship that is harming them, that I haven't cut you off as a friend. The main thing is for them to know that there is a support system to come back to whenever they do decide. And which brings us to the last part, which is the connection part. Keep with those folks. You know it. Don't whisper behind them and let that be the family secret or the community secret. Connect with them and make sure that they're okay. And keeping in mind again that they're invisible scars. So it's not, there's a lot of stories and movies around someone having a black eye and they lie about falling down the stairs, but we can't see the invisible ones. So it's by you being in their life and remaining and talking to them, and you staying there and saying, I'm not going anywhere. I'm not going anywhere. I have people in my life right now that I'm like, yeah, they're not putting hands on them, but they are absolutely abusive. But what can I do? Support them. That's it. Active process, like I shared earlier, that's through therapy, that's through self-reflection, that's through body work. So therapy, I know my African folks, they don't like therapy. They don't like therapy. Go, please. Go talk to someone who's objective, who is not your auntie, your uncle, or somebody who will, shun it down. Go whenever I see Africans come in my portal as a new client, I am so happy because I'm like, thank God. They are aware, they are clear that they need something, and I'm going to be an objective voice for them. I don't want to single out Africans, but I do find when I'm talking to people from our African countries, they're like, yeah, I pray about it and all that. But again, healing is intentional, and God created us therapists, right? So, yeah, we are here to support you when you are going through these things. So, be intentional, go to therapy or your own version. Some churches do have a therapy wing, a grieving wing. They do have that. Don't be too ashamed to say, well, I'll just figure it out on my own. When God is pretty much laid out different forms of support, but also again the self reflection speaks to really talking to yourself and saying, yeah, something bad happened to me. This is the part that I played. This is what I understand um, happened to me. Through self-reflection was where I made the connection from childhood. Oh, so when those people abused me, like Dr. O said, I have a scar on my face for the rest of my life. It was so close that it almost blinded me. I could have been a blind woman, but that's not what God said for my life. He needed me to see for the goals that he had to accomplish. But otherwise, when I did that surgery, when I went back to my family, I could not see out of my eyes for a whole week. So I had to connect that once I left the abuser as an adult, I was like, I had been experiencing this since I was a child. I just figured out a new way because as a child, I was figuring out a way to please my abusers. I would do more chores. I would be the good kid. I would get good grades. I would try my best, and that absolutely did not prevent me from getting my butt beat or me being um uh just put down and being told that your family didn't want you, that's why you're here, and all of the psychological things that they put me through. I had already gone through that as a 7-year old and a 6-year old and an 8-year old. I was with that family from 3 to 11. So it was ingrained on survival. Survival had already been in my life. So, of course, I meet someone who is saying the right things and all that. And then I find myself right back in that kind of situation. So once again, survival, doing it again. And so I had through self-reflection, through prayer, through therapy, I was able to make that connection. And then the body work, being able to do meditative practices, nutrition, water, all of those things, they all go hand in hand. And so it's important to make sure that you are cognizant of what your body is doing, or helping if you're not the one experiencing domestic violence, intimate partner violence, helping whoever it is, your loved one, understand that, hey, let's go for a walk. Let's clear our minds. Let's do this. Let's do that. That'll help. Setting boundaries, making sure that you make sure that the abuser is nowhere near your network, whatever that looks like, and making sure that you put important things in place where you are also creating boundaries for yourself. What are the things that I once did? Is it acts that I did? Is it places that I went? Being able to put those barriers around yourself so that you don't find yourself back there. And then, of course, if faith is important to you, how do you reinsert that? Where that is helping guide your thoughts, your processes, and all of that. And one thing I tell my clients to do, some of them, they're like, oh, Mimi, I can say the words, but they don't mean anything. Well, then you're not actively in healing because words are very, very strong and powerful. And when you affirm certain things, they come true. And you have to be consistent just like anything else. So affirmations, I'm allowed to heal at my own pace. but I must choose to start. So saying words that affirm your process will help. And then time passed versus healing progress. Time measures distance, not depth of a recovery. Unhealed trauma resurfaces in relationships, parenting, and self-worth. So if you were just focusing on time and just saying, hey, that domestic violence relationship was 15 years ago. And of course, now possibly you're married and you have children. What are you going to teach your kids? What in the world are you going to teach them about how to have self-worth and self-love and being able to affirm themselves? And even I've had clients where they had a hard time explaining what happened to their partner, and that impacted their relationship in a great deal, of course, in the sexual area, but even in the emotional area, not being able to talk about it, deal with it, address it. Behaviors are coming up that the partner has no idea about, but that's because you just let time pass without healing. And that's why this is important. Time does not heal, healing heals. And I spoke about this briefly. And this comes up when I meet with people. I talk about the importance of community. And a lot of times people talk about the resources. Yes, there are. I'm a domestic violence survivor, but I'm also a counselor. So I know lots and lots of resources. But the community is what's important. The people who know you, who love you, who care about you, um, are what is going to push healing into acceleration as opposed to the person trying to do it on their own. I know for me, what healed, again, I shared earlier, was the relationships kind of coming back to me in different forms. I was able to join a church. I was able to reconnect with some friendships. And sometimes if I think about some of those relationships, they're even better now because of what I went through. And they were able to say, you know what, you were not yourself. And I knew that it was because of that person. I shared this in my book, but I also share this in presentations that I had a supervisor at the time that I was in the middle of that relationship. And I had worked with her about maybe a year or two, maybe a year or two before I started dating this guy. And one day she called me to her office and I thought I was in trouble. And she said, close the door behind you. And she said, I just want to check on you and see if you're okay. I think that you're not the same person that I know. And it's been ever since you've been with this guy. And of course, I vehemently denied that. And I told her, oh my goodness, no, that's not true. He's amazing. He's this and that. And I was lying through my teeth. He wasn't that amazing. But of course, I didn't want to tell her, yeah, you're right. I need help. But it was through relationship that she took that risk. I could have told her, mind your business. Everything's fine. But she felt that she could be a resource. And what she shared with me was that she was also in a domestic violence relationship. So she was like, I can see the signs. And, you know, by the end of that conversation, I was still denying it, but I never forgot it. And in my head, somewhere in the back of my head, I was like, what did she see? What am I like now that she saw enough and felt that she needed to pull me to the side. I still don't know. I saw her once I invited her to dinner when my book was published and I reminded her of that conversation and she said, "Oh yeah, I never forgot that conversation. I was so worried about you." And we both cried at dinner and I just thanked her for taking that risk of telling me that I am here as a resource. You don't have to stay there I care about you and all that. So community is very important. Please let's not ignore that this is happening in the community. It is one of the myths is that it's in certain types of communities. No, it's in every single community. It's the affluent, it's the poor, it's the white, black, every creed, it's everywhere. And when we know it, it's important for us to say, hey, I'm here. Take a risk like my supervisor did and just say, I know that something's not quite right and I'm here. That's all people need to know sometimes. You cannot save them. You can put a pound of paperwork in front of them of domestic violence resources. They will throw it in the shredder. But what they need to see is that support, that love is unchanging, unwavering. Whenever I decide to do that, to leave, I know that you're there. And that's what staying with them through it says. And then, of course, there's a lots of supports. There's a lot in the DMV area for those who are in DC and Maryland and Virginia. There's shelters specifically for women who need refuge from their abusers. There's community programs. When I have done research on this topic, a lot of the websites have a way for the abusees or the victims to not alert their abusers that they're looking up help. And so there's something that popped up. It did it in like 4 websites where it says, hey, it kind of made it go away so that the abuser isn't aware that they're trying to seek help. But there's lots of supports. There's support groups. There's faith based, I'm sorry, groups, and other ways that people can take care of themselves. But no one can heal in isolation. Get the support, and let's help those who we know need that help. And healthy family and friend support, believe survivors without judgment. This is one of the things that I try to help people understand too. When someone says this is what happened to me, it is not your job to find out if it's true or not true. um, Believe them. That's their story. And then offer help, not steering them to leave. Because when we steer them to leave, they stay even longer. So again, the goal is to create community, to let them know we are here, we love you, we support you, and I'm not going anywhere. And letting them know you don't deserve this. You're not alone. I'm here whenever you're ready. And those are ways that we can support. And then for those, and I want to add a little bit, it's not on the slide, but it's important for maybe related to this slide in a way. When I was writing my book, I remember I had written 7 chapters. I was done. I had read my book like 4 or 5 times and I was done. I'm like, I'm sending it to the publishers. I'm done. And then I had my personal therapy session, and my therapist was like, well, you're not done. And I'm like, yes, I am. I've read this book 4 or 5 times. I'm not reading it anymore. She said, well, you need to speak to the collateral damage and the healing of the family as a whole. And she said, think about, because I talked about how my abuser would leave voicemails on my mom's phone and tell her awful things about me. And so my mom was absolutely terrified. And she was just terrified. She didn't live close to me, so she was always trying to figure out what is going on with my daughter. Who is this gentleman? She had met him, but she never, ever, ever from day one felt something was wrong, off. She couldn't name it, but she just didn't like the guy. And then he started to leave these messages, and I talked about that in my therapy session, and my therapist was like, people need to understand that there is a collective healing that needs to take place. And think about if there are children involved, and a lot of times there are. And even if you manage to leave that relationship, now you and your kids need healing, not just you. So I want to make sure that I don't leave that out. I have a whole chapter on that because my therapist made me do it after I'd finished. And she was like, nope, you're not finished. So I took another month to figure out what to write about collective healing. So it's in there for those who want to read that, read my book. And then I think we're coming to the end. For those who want to help, listen without pushing, ask before acting, share resources discreetly, and prioritize safety. Sorry. Yeah. So, I mean, basically, what this is speaking to is that there are ways to support someone without being pushy, but also understanding the sensitive nature of helping. And sometimes, and I am grateful to God, people always ask me the question, how did you leave? I'll be honest and say I didn't leave because of myself. I left after my mom kept receiving messages from him, and I couldn't fathom the abuse being extended to her, and I didn't want her to worry, and so I just ended it. And then the day after I ended it, he popped up at my job. I opened the door. I used to work with individuals with disabilities in their home. And so, in preparing them to leave out for the day, I opened the door to let my first person out for the day, and my abuser was standing right there. I can say that I'm grateful to God because there's a lot of women who their life would have been over right then and there if he, wanted to. I was absolutely vulnerable, wasn't prepared for it, didn't expect it. Instead, got so good, he just begged and begged and said, hey, I'm sorry for everything and all of that. But, there's a lot of women who that's not their story and their lives were ended. And so the discreet aspect is, and that's why I mentioned about the websites, there's a way that they kind of discreetly steer the women away from their website and tell them how to connect with them. The discreet nature is for those women who would end up losing their life if their partner wants to maintain that power and control and could likely take their life. And so we want to help them, but be as safe and discreet as possible. And And I think this is my last slide. Yes, it is. So in closing, healing is the work, not the weight. And um, in when we think about healing is the work, it's not an easy thing because I would say even with the many speaking engagements that I've had at this point, writing a whole book about it, there's still work that comes up that I realize when I meet with my therapist, oh, I still feel this way, or I still have I still have parts of the story that's still suppressed, that won't come up unless it's triggered by something else. So it still requires healing. But this I found in talking to people who pull me to the side at in-person events to say, "Oh, I'm a survivor. Thank you for what you're doing." All of that is absolutely helping me so that my experience isn't a waste. My experience wasn't for nothing. It's helping myself, but also helping others. Um, and so, affirmation: you are not what happened to you. You are not what happened to you. You are what you choose to heal. So, who are you as a survivor? If you're on this call, you don't have to announce yourself if you don't want to, but what do you choose to heal? What do you choose to say you are because of this healing process? You're not what happened to you. You're not the victim, as they say. You're a conqueror. You're a survivor. You're all these affirmational words, and you have to speak that into your spirit so that it comes out as you talk about your story and as you work through the healing process. Um, so these are resources. I can share these slides, Dr. O, if people need it. The book on here, The Body Keeps Score, No Visible Bruises, that's one that's very, very common. But of course, my book is on there, A Whole New World as well. and my book basically talks about the strategies I use to heal from my experience. And this is me right here. That's what the book looks like. It's on Amazon, and it's been great. It's been a great year of meeting people and talking about what I wrote about, talking about my experience. But like I said, I can share this with Dr. O for the QR code so that you can go directly to Amazon. Um, and last but not least, I do have a YouTube channel. I have one episode one episode, but I'm growing it. I'm thinking and talking to different people. But I would be so grateful if you all can scan that and subscribe so that I can stream from my mobile device and not always have to sit at home because sometimes I'm out in the community and I just want to talk to people and I want to be able to stream from there as well. So if someone can if y'all can all scan that, I will gift the first person in the chat to say I've subscribed. I will gift them a t-shirt that says I'm the message, like you see me wearing there.
I just
So
subscribed. I subscribed. I just
Dr.
did.
O, is that you? You're the first person?
Yep.
Okay. Well, a gift coming your way. But thank
I
you
did.
all for listening to me. I appreciate um, Dr. O and Medical Mondays and all of you for allowing me to speak to you all once again. And I am here for any questions. And I pass it on to you, Dr. O.
Wow. Thank you so much. Thank you for sharing. It takes strength to do that. But before I go on, if you please leave the QR code for the book for a few
Okay.
minutes, or put it in the chat box.
Okay.
Even better. Yeah.
I will do that.
You can put this slide down so that I can get everybody here
Sure.
and be able to see those hands. Um, thank you. Madam VP, you have your hand raised.
Oops. Okay.
Kindly unmute and ask your question.
Yes, ma'am. Thank you.
Thank
Three
you.
three things. Number one, I'm protesting. You cannot be the one that gets the t-shirt. You're the host. You could always get a
Oh,
t-shirt.
okay. Ooh.
Somebody else
So
has to get a t-shirt. That's number one. Number two.
she's right. She's right.
I
I was too fast. So no, before you go to number two. So who has subscribed? Let's see.
don't I don't know. I'm driving. I didn't see anybody.
Who has subscribed? Please
If
speak up.
anybody subscribe, I will gift a t-shirt.
Unmute. Huh. Interesting.
They were
Okay, we can go to
intimidated
number
because you
two
did it
now.
first.
Okay, I see Miss Bellinger.
Sorry?
I wrote it down to subscribe to you, honey, but my phone is on the charger in the other room.
Did you subscribe? Pure
My
joy.
phone is on the charger in the other room, but I did write it down to subscribe.
Okay.
Okay, you get the
I
t-shirt.
will be.
Okay,
Okay,
perfect. Thank you so
thank
much.
you.
I plan to.
Thank you.
Please subscribe, please, so I can stream mobily. Please, everyone. There's 30 people on the call. If I can
Mhm.
get the
So
subscriptions,
number
that'll be great.
two.
Yeah, so number two is a question. I mean, it's a comment because, when we're talking about all of this abuse and domestic violence, I don't know if domestic violence is only attributed to people in marriages or relationship. Otherwise, in my opinion, there are other domestic violence, abuse, and all these other symptoms you describe. Most of us that grew up from polygamous homes, you went through that one way or another, and subliminally you just dealt with it. But my question now is, as an employer, because one of the things you mentioned that your boss pulled you to the side and say, "Hey, you want to talk?" I really don't want to miss it. If any of my staff is going through stuff, of course, it shows up in their attendance. They're not always, there's tardiness issue, there are things like that. But there's also the imposter syndrome that starts to create self-doubt in them, erodes their confidence, even though they're very competent in what they're going to do, and before you know it, a very good employees start falling to the side. What
Mm-hmm.
is it? Because I'm interested in knowing uh, what is it that gave it away to your boss? And I know you say you asked her that question, because that would be a good resource for me to know, because it's very difficult to overlook those things, and you work with people 8 hours a day, and
Mm-hmm.
you're assuming that, oh, they're just lazy, they just don't want to do their job. But if they're going through other issues that it's not really easy to come out and talk about, I don't want to miss the opportunity to provide some kind of intervention without intervening, if you know what I mean.
Mm-hmm.
Uh,
Mm-hmm.
you know, at least to be a listening ear, and and there will people that will be manipulate these things once you make it know. But I want to make sure that we don't get rid of a good staff who's going through domestic violence and unable to talk about it. What are the signs? What should I look for? Thank you.
So that's a great question. And I don't think when I met with her, like I said, it was 17 years later. So I don't think she could remember what were the specific signs, but she went off of a hunch. I think if I had to guess, I think I was a little more, like I said, my body, my mind was moving a lot more hyper vigilant. I was I was less playful. I'm always playful. I'm always jokey. I'm relaxed with people, and I was a little more tense. And I was very hyper vigilant, and I was always making sure that everything was on point, and everything um was not going wrong. And, that's on the work side. With people that were in my life, I didn't want anyone to say anything that was going to make him mad. I didn't want to say anything that he would later tell me I said that made him mad. So I was very hyper vigilant. And I think that that's probably what my supervisor at the time said, or felt, I should say, that I was a lot less playful and a lot less personable. I wasn't myself, where, you can just, it's always good times, outside of the work. It's always good times. She had, I think at that point, she had invited me to her house. Um, I think we had a baby shower, something. We had different events, and it just was different. And she felt it was different. But I would say, to add to that, I would say that the relationship is more important than anything else. The only reason that she felt that she could even do that, like I said, in thinking about it, she did take a risk, but she evaluated it and felt that I have a relationship with Mimi. At minimum, she would tell me to mind my business, but I care enough about her to pull her to the side to say, I've seen something and I hope you're okay and I'm here. So I would say to you, Madame Lara, that the thing that will help you as you pay attention to your staff and as you see them struggling, if they are, is to kind of fortify your relationship with them so that you do, kind of gain that access a little bit to say, and not pry into their life, but more so say, hey, I'm here for you. I care about you. I do see some changes in your work
Okay.
performance, and I just
Mhm.
want to make sure everything is okay. And
Mhm.
from there, it takes time for them to say, you know what, I don't think everything's okay. And I think that she would be a good listening ear if I talk to her, and I won't get fired just by talking to her. I think the relationship helps with that so that you can then do the next steps of that.
Okay, just one more comment. Do you, in your experience and in your research, do people with, who are going through, are they more likely to recluse to themselves, or are they overly aggressive towards others because they're going, because this thing can show up in different ways.
It can. And I've seen both.
Yes.
For me, I was becoming more reclusive,
Mm-hmm.
and that is a tactic by the abuser to isolate you. So you'll find yourself where the things you used to enjoy, the friends you used to hang out with, all of a sudden everybody, um you know and with my abuser, everything was stupid. And oh, you like that? And oh, that friend that's a really good girlfriend, there's nothing wrong with her, but all of a sudden he's saying she's a bad influence, and then you start looking at her like, oh, maybe I shouldn't hang out with her. So it's a tactic. And
Mm-hmm.
so people, the victims, survivors, they've ranged from all of those versions. I was reclusive, but other people, in order to, and those who are aggressive, keeping in mind, they're being aggressive to make sure that people don't come in to see what's actually happening. The aggression is more of a way to shield people from actually seeing that, oh, you're really, really struggling here. So you can see a range of that, but regardless, I think with any one of those of us that want to help, the relationship is what's going to help them come around, regardless, whether they're reclusive or aggressive. I think the relationship will help um, you
Okay.
get across and through to them.
Well, thank you for sharing your
Well,
story.
Madam VP, before I call on the next person that raised their hand, I want to assist in answering that question.
Thank you.
Two of your questions. Um, Someone is asking, Dr. T is asking that you please post how to subscribe. And if you please
Okay.
put in the chat
Yep.
box. Thank you while I do that. Your first question, abuse, domestic violence, that is it just the home? Is it
Just a marital relationship, or
marital
is it?
relationship?
Yeah.
It is not. Children get abused. And you know what? Aramide, a counselor who just spoke, who is speaking today, is an example. You see her face on the right side. That scar
Yep.
was
Right
her
there.
abuser.
Right there.
Mhm.
It's about, I would say 3 inches long across my face. Yeah. And how I got that was, again, this was when I was a child, so let's just say 30 plus years ago. The Similac milk was in a can. The agulu, I don't know how else to say it.
Can.
Is it?
Yeah, it's
Uh-huh.
the can. Yeah.
So she, the mom in the home, she opened it for her son, who was still a baby at that time. And I was taking the trash out, and then she just turned and looked at me and said, "Are you stupid? You didn't look at the whole kitchen." And then she threw the can at my face, and it cut me to the point where, when you cut your skin, your top skin, it will bleed. When you cut into the white meat, it does not bleed. And so I knew that as a 7-year old. I looked in the mirror and all I saw was white. And so, yeah, that's domestic violence in the home as a child. So, and I said, when I started my presentation, domestic violence is anyone that you live with, whosoever that is. And so sometimes that is a parent to child, that is a child to parent, um, that is a sibling to sibling, that is, whoever is under the same roof, whether it's romantic or not.
And in her case, her mother put her with this family since she was 3. And she lived with them till she was 11. And she was abused all through. So then she got married and then, she went through abuse again. So abuse spans all areas. Any relationship can become abusive if one of the participants is an abuser. So I wanted to answer that question. And then, the question about identifying the traits is tough. I remember that when I was graduating from medical school here, my class was the class that was used to do the dry run on the practical exam. And I I got 90 something percent. I mean, I got the diagnosis and treatment for all of the patients except one. The patient complained about things that just did not make sense. I could not put it together. I couldn't put anything she said together, and she never gave me an eye contact. So those are the telltale signs. And I missed it, totally missed it. It was domestic violence. And I promised myself that I will never miss it again. But guess what? In real practice, I missed it again.
Oh, wow. So
Yeah.
that, okay. So people like that will not want to talk to the doctor.
No. I've seen some would come when I develop relationship.
Got it.
And it came to a point, with years and just the Lord. It's just God, I would say. I've been able to catch a couple where I just ask point blankly because nothing makes sense. And then I ask about their partner and the eyes go down. I'm like, no, you got to talk to me. There's help. I've had a couple come out and tell me, but I almost lost one that I missed. And I saw her so many times. It was after the fact that I now thought, oh my gosh, the signs were there. I just missed it. And I myself talking, you would never know that I went through domestic violence on all fronts, physical, mental, emotional. And I'm not ready to talk. I still shared with two ladies last night.
Yeah, you see, that's one of the things because when I look at all of us that went through polygamous home, it was all kinds. I mean, even if it was not physical, they talk down on you, look at you, you never amount to nothing. I mean, constant berating, constant from your stepmom or whatever, those who have stepdad or whatever. So I guess some of us grew thick skin to that because, uh,
It is not thick skin. It is your coping skill and
I see.
Survival.
Got it. Got
and
it.
that's what Aramide was trying to say, that the reason why it's difficult is that everybody handles things differently.
Of course.
I've shared on Medical Mondays before when my children had a meeting, called me into a meeting for something that happened and said that I needed counseling. And I was looking at them like, what on earth do they mean?
You
What do
need
you
a
mean I
dog.
need counseling? And my younger son told me a story, asked me something that happened in my childhood that my dad had discussed with them, I mean, freely. And I told my version of it, and he told me exactly what happened. And I was like, yeah, that was what happened. He said, Mom, your coping skill is suppression, and it is not healthy. So, what we call thick skin may be suppression, and it is
Yeah,
not.
for sure.
And that's why we're encouraging people, if you are in this situation, there's help. Come out, get help. I got into counseling. I am in counseling. Before, I never shared with anyone, not even my parents. I won't say anything. I'll cry and cry in my bedroom. I come out, wipe my face, and keep it moving. If my children were on here, they would attest to it that years later, when they found out, they were like, Mom, how did you do it? We lived in the house we didn't know. So everybody is different. We all have different coping skills, but some are not healthy. Mine definitely is not. You suppressing thing is not, right? I have counselors on the platform. Is it the right coping skills?
It's not. Mm-mm.
So I have to walk through that. It's not an easy terrain. It's not, but it's pliable. And we are applying it. Nkechi, are your questions answered, ma? Nkechi, kindly unmute.
Yes, yes. I mean, very well. Um, at this point for me, I just want to make sure that I don't ignore, uh, because, I listened to Nkechi's presentation, was it last week or 2 weeks ago?
Last week.
Yeah, and the way she was hammering, I mean, passionately saying, it is not, don't. I said, oh my goodness, this person is really, still angry and the pain is on the surface.
Mhm.
But when Aramide spoke today and talked about the boss pulling, that really kind of, it's got to me because, I've had instances when I have management meeting and they're saying, no, people are not performing, they're underperforming, you need to let them go. And I'm always like, no, let's figure out, the root cause. But I never thought about this being a root cause, or could be one of the underlying cause. I never thought about, the name, which could very well be, may not be,
Absolutely. Absolutely.
you know. So, but thank you for sharing, all of you. You all have stories to tell, one level or the other, but some of us got over it.
Yeah, we
Yeah.
have to. So, Nkechi.
Yeah, so please, good evening, everyone. I just wanted to add to what Madam VP asked. And yeah, she just said it, she's in management and what are signs and ways to help people that are going through such things. I'm gonna tell you there's so many things that are signs that we tend to not understand because we're not in that person's shoes. One is people that are going through domestic violence, they tend to cry a lot because they don't know where to go to. You see them with red eyes, they tend to want to bend their face away and not talk to you directly. You understand? They tend to isolate themselves because the abuser wants them to isolate themselves from you. You understand? They tend to isolate, like break room. They don't want to be with anyone. They watch before they go. They watch their back. You understand? And then another thing is the man doesn't want that woman to speak up. Some would send gifts. Mine was sending flowers to my workplace. And everybody was thinking he was a loving man. He sent flower for 9 days, beautiful flowers, bouquet of flowers. And everybody was jealous. But inside me, I knew I'm in pain. I was going through hell at home. You understand? And then he want to buy me things that nobody buys, like telephone and all that. And those things, when you start seeing people sending gift, a man sending gift to a woman at workplace, that's one sign. You need to really look at that. You need to really look at that. When a woman is trying, sometimes your abuser will follow you to work. They want you to make mistake. They want people to stay away from you. You are this person that is doing a lot and doing it very well. And because they want to, place you in a box, they might say something before you leave home that would demoralize your mind. When you get to work, you start making mistakes. And people will start isolating themselves away from you or labeling that woman. Oh, look at the way she's talking. She's crazy. When you start hearing a story of a woman that is going through something and they are labeling that woman, when you are not a psychiatrist or what you call it, right now, I don't know. I'm really, how would I say, hyper with all the things with what Sister Ramide said because it triggered some things in me. And I'm going to share some a little bit. Like you were saying, right? They would want to isolate you with labeling you and calling you names And you yourself, you'll be looking at yourself. Is it true? Is there something wrong with me? And before they start calling you that name, they started telling people. You understand? They don't want you to share stories. They'll tell you, Mama, Dad, don't answer that person. Oh, she's gonna come and tell you something. Oh, she's talking too much. But that talking too much that person is doing is because she's endured a lot. She's been bottled. She's endured a lot. So now she wants to outburst and thinking that, look, something she's been going through for more than 10 years can be solved by you, by talking to you. That 20 minutes you are giving her, that time, just allow that person to talk and pick some things on how to help that person. You understand? Sometimes dressing. You know this person, she's always vibrant and all that. And all of a sudden you're seeing that person, her dressing is off a little bit. You understand? Because that person is trying to get out of the house. You understand? Finding freedom outside. We only work 8 hours. We stay home with our abusers for the rest of the hours. So that can be very, very bad. That could be trauma itself. You understand? And then at workplace, they would do something. They might call you on the phone and say something that would trigger you to start misbehaving. So as a manager, as a management, check all those things. And before you think of firing somebody and all that. Like me, I'll give you example too. My situation that I'm doing well in a place, in a job, and then this person wants me to make mistakes and all that. He would use people to say things that he knows I dislike. And that could trigger something. That could trigger something. So that's another way you can look at that person. If you see somebody, when you say something and their dominion changes, immediately you say there's something going on with that woman. It's not easy to share your story with people. They have to confide in you. They have to see that you have a listening ear. The minute you don't have a listening ear, they tend to stay away. But if you show listening ear, you understand that is why it is good at workplace. Be respectful, be kind to people. You understand? Accommodate people no matter how bad they might be. You don't know their backstory. You don't know what is going on with them. You don't know what they are going through. Just like Sister Rami, they said that you understand things triggers her, or she had somebody that she was working with and she got triggered by the person's behavior. You understand? It does happen to me. My ex is very tall. He's like 6'4", 6'5", and dark in color. The dark. If I see any tall Nigerian man with his name, his same name, oh my God, you just see me just get so mad. But I have to start praying to God that that's not that man. Even the man that hurts me, right? I need to forgive him and let go. The things we used to do together, like when I first came here, of football, every Sunday he watches it and all that. And when I see football, I'll just turn it away. I would just put it away. Basketball, I'll put it away. How did I get over that? Is because of my son started playing football. My son started playing basketball too. And then I started, as God wants us to forgive, when I see men like that are tall, that bear his name, I tend to start controlling myself and say, look, stop. This is not okay. God does not want us to do this. You understand? But it's not easy. It is not easy to heal. It is not. Even the counseling too. If we go to some counseling, you understand, counselors, they tend to say, you really went to this? You went through this? If somebody start telling me that, I tend to quietly walk away. I will not go back. Oh, I will not go back. I need a counselor that can relate and just listen and don't judge me. And finally, our Nigerian brothers and sisters, oh my God, they had to eat more. they would also give you, they are abusing you emotionally, psychologically. They do. Nigerian brothers and sisters, instead of helping you, they will start with the story. She wants to be a single mother. She wants to live alone. Oh. They brought her to Nigeria, America now. She has open eye. Oh. You understand? But are you inside that house with me that I'm going through those things, those closed doors? And our abusers tend to be very, very quiet, like mine. Oh, my domestic violence abuser, oh my God. If you see him, the most quiet, handsome, quiet man. If he sees you now, he say, oh, yes, ma'am. Yes, ma'am. He will not say more than two single words. Yes, ma'am. He will even help you to open door and everything. In front of you, you do everything. But inside, what he's doing to me was like, who can I tell? Who would believe me? And our family too, they add to it. They give us trauma. Our family abuses us. Yeah, I beg, be quiet, Jerry. Go back to your husband's house. Go back. He's not doing you anything. Are you the first they beat? Are you the first woman they tortured in your life? You understand? Everybody, even me as a mother, I suffered like that. I just had to manage. You understand? You are doing it for God. You are doing it. God say we should obey out. God did not say a man should be beating a woman or enslaving woman. There's no way it's written in the Bible. So, ma'am, it comes in different way. Not only the husband abuse, friends do abuse us too with the way they talk to us. So this is where I rest my case. Thank you, ma'am.
Thank you very much. Thank you. Thank you for sharing again. Dr. Guleye, kindly unmute. You mute.
Thank you.
Yeah.
We've touched on spousal abuse, domestic violence, to include all parties in the home. But there's one aspect that I think nobody wants to talk about, and that is parental abuse. You see, not everybody is cut out to be a mother. No, not every woman is cut out to be a mother. We already know about that of fathers. They don't even hide it. If they don't want to be fathers, they just leave, right? But then they might leave you in the hands of a woman who's not cut out to be a mother either. Not every woman has maternal instincts. And unfortunately, some of us have found ourselves in that situation. I I usually don't share this story. I don't think I've ever shared it outside of my family. If I have, maybe somebody that I deem very, very close. But I was raised by an abusive mother. And I would have said, maybe it's me, it's my fault. But when all your siblings have the same story, then you know it's not just you, it's the woman. And I I have forgiven her. We're on good terms now, but for years we weren't. And she's still having problems with my other siblings. Um, it is a difficult thing to talk about. Very, very difficult. And even before my siblings joined the bandwagon in saying, what kind of mother do we have? Even before then, I somehow knew it wasn't my fault when her friends were praying that their children, their daughter, will be like me. When they'll be telling my mother in front of me that she's a very lucky woman to have a daughter like me.
Mm.
But she never saw it. Or maybe she saw it, but she just couldn't control herself.
Mm.
And and I think it's a personality thing, which she didn't know she have, or she's in denial that she has, because it's not just us, the children, it's whoever gets close to her gets burned.
Mm.
Um, and here's the thing. When you're raised by an abusive parent, you do one of two things. Sorry, I just pulled into my garage. Let me go away from the noise. When you're raised by an abusive parent, you become one of two things. You either so emotionally wounded, you're so scabbed, because that thick skin that Madame Lara was talking about is actually scab. You're so scabbed that you put up barriers in your own relationships. Because of what I went through, I became very distrusting of elders. In fact, the quickest way to get me to dislike you is to use the elder card on me, because elders have shown me that they're abusive. Or the elder in my life, the person that I trusted to love me, to care for me, didn't. So how can you be any different? So when you put up the elder card in front of me, I just put up a hex finger. I'm holding my phone, so I really can't do the finger. I just do the hex, the hex you do for witches. I just do that. Yeah, exactly. I just do that and I run away. But funny enough, most of my friends are elders. If we can be on friend term, yes. But if you want to be, the quote unquote African elder, I will run away from you. And then to add insult to injury, she left my father when I was 3 months old. And um, my father also happens to be just the kind of guy who is just into himself. He married another woman, and I guess that family became his priority, not us, me and my brother, not us. Even till this day, I'm still trying to win his love. Now he's old and is going through some health challenges right now, dementia and whatnot. And she's keeping him away from us. But the few times I've been able to speak to him, I have to remind him I'm your daughter. The last conversation we had, after I hung up, I then sent a text message. Dad, since I've been in America, this is what I've done, this is what I've done, this is what I've done. I've served in the military, I've been a teacher, a professor, and now, remember when I was back in Nigeria, I loved manufacturing? Well, I'm back to that now. I'm a manufacturer in the US. Till this day, I didn't get a response.
Mama Suya.
That was 2 weeks ago that I sent that text.
Mm.
No response. Still trying to win his love. So, yeah. Sometimes our personalities are shaped by what we went through as children. And because of what I faced, I do not tolerate abuse. I got married to a man, thank God, who is not abusive. But like every Nigerian man, they first come with that behavior of, I'm your husband. I'm the man, I'm the husband. I quickly put that in check. If you want to stay married to me, we're not going that route. I will never tolerate abuse. And that's why I think I said that in one of the Dr. O Mondays, that is probably the reason why I I adopted that Buddhist philosophy of non-attachment. Because if I sense abuse at the drop of a hat, I'm gone. I leave. I leave. There was a point even in my marriage that I was ready to abandon everything, even my children, and just leave. I said I was going to become a nun. I'm not a religious person, but I said I was going to go to some other state in America and join the convent and become a nun and be done with men, with life, with everything. That was my Buddhist philosophy of non attachment. I know it's avoidance now that I think about it, but we all have coping mechanisms. And that was mine. I am scabbed. I know that. I know that. And that was why I dropped teaching, even though I loved it. I dropped it because I just could not tolerate the abuse anymore from administration, from parents, from the state. I just couldn't. I left after 15 years. I was not of retirement age yet. I mean, who retires at 55? But thank God I had other skills. So I was ready to drop a six-figure income and just leave. Now, my income is less than that, way less than what I was earning, but I am happy. I am satisfied. And that's what matters in the end. Thank you. Just wanted to share that.
Thank you so much. That was deep. And I'm sorry because, like you said, you're still trying to get this love, and it'll come by God's grace because there's nothing God cannot fix or mend. Thanks so much for sharing. Thank you. Madam VP, kindly unmute. You have your hand.
Wow.
Yeah,
The other doctor, oh,
yeah.
I can still hear the pain in your voice,
Mhm.
and it's still as fresh as yesterday.
Mm.
But don't be a Buddhist. I'm coming to your house. We'll talk about Christ. I understand the philosophy. But thank you for being so vulnerable at that point. You don't need to fight for his love, but it's great to have somebody, it's part of the aspiration. A lot of people strive for to be something just to please daddy. You were probably daddy's girl, and you wanted him to see, look, and there's absolutely nothing wrong with that. Absolutely nothing wrong with that. But while we're talking about this, you mentioned something that I also think is important. Some of these things are passed down in generational ways. Like your mom that did that. Because you see, today mental health is now being addressed, is now being talked about. A lot of people have gone through mental health way back in those days. I want to believe that any human who carries a baby for 9 months felt something. To leave those children and walk away, there might be some clinical issues that we would never understand, that we would never know. So, and some of those people's behavior, the way it manifests, it feels like they're mean-spirited people and things like that. Because when you look at even the men, the environment in which they grew up, that's what they bring to the marriage. The environment in which they grew up, and even some women. So at some point, I'm glad that this is about healing. That is the topic that Dr. O called it. It's about healing. Uh, you're only going to manifest what you feel inside. So we would have to pray and emancipate ourselves from some of this toxic emotion. Look at all that you have accomplished. Who in their right mind would not want to have a daughter like you?
Mhm.
You're not only well accomplished, you're also so fun. You're a fun human being to be around. You love laughing all the time.
Yeah,
Might be the suya that does it, but but you are a great human being, very caring.
yeah,
You know, a whole lot of people cannot go into teaching other kids if you don't have some love for others. So there's a lot to be loved about you. You don't need to look for one person's love. But it'd be great for them to acknowledge who you have become. But look to God. Because when you're filled, that love and belonging, when you talk about Maslow's hierarchy of needs, those are the things that he talked about. The first category is the self-actualization, which we all strive for. And I remember the middle. I remember the middle being love and belonging. And we all look for it in different ways. Even in the church, you're subject to abuse. You have pastors that want to take undue advantage of you. In the mosque, you have religious leaders that want to take advantage of you. I mean, look at the Catholic system. All of those boys were molested because they wanted love or to belong to a community. So All of this information that's been shared on Medical Monday, we have to pick it apart and see how we can use it to move on, to move forward, And I'm sorry, Doctor, just 30 seconds. When I was growing up, there's a British group, musician. They're called Eurythmics. Some of you that are younger probably know the song. It says, some of them want to use you. Some of them want to get used by you. Some of them want to confuse you. Everybody's looking for something. But he said, hold your head up, keep moving on. That was the message. Hold your head up and keep moving on. Thank you.
Thank you so much. Thank you, Madam VP. Thank you. We all need love. Everybody needs somebody. We do. And I feel you, Dr. Guleye, because the love of a mother is the love of a mother, the love of a father is the love of a father, the love of a partner is the love of a partner. The love of a child to a parent also is different, and they're all very important. And he who feels it is he who knows it. I get you. I feel it. And my prayer is that the Lord will fix this. I've seen it happen. It's not too late for them, not for you. I'm glad you reached out. I would encourage that every now and then that you reach out, you keep reaching out again. Sometimes the abuser at this age, at this point, don't know how to come back again. They don't know how to bridge the gap. And sometimes it may take us to do that. It's a blessing when one is able to forgive their abuser before it's too late, maybe before they pass, or maybe, I think that's why for me, I still say it. I don't even know what to say. I don't know where to start because I took care of all of this at some point and have peace. I made my peace and I forgave. So I'm going to encourage all of us to start with forgiveness. It's important. It's important. And for people who don't have relationships yet, who are not married, the young ones on the platform, or even the older ones that maybe, they're getting into a relationship, there's always signs or a sign. This partner would show signs. All of us that have been through it, when we look back, we can say that, what there were signs that we, for one reason or the other, for our own reasons, we decided we were still going to go ahead. When you see signs of this going on, of an abuse, of this person is abusive, cut the relationship off. Don't don't continue because you're not going to be able to change them. But when it comes to parents, or you didn't choose those because you did not choose your parents. God matched you. So that's different. You just find yourself in that situation. So, but my advice is that if we are in a relationship and we see that it's abusive, let it come to a time that we say, okay, enough is enough. And it doesn't matter what kind of relationship it is. We need to get to a point where we don't let it continue so that we don't find ourselves in places we don't want. And like I said, healing is different for everyone. It's important to get into counseling. somebody who one can talk to, open up to, and can help one navigate, get through it.
Dr. O, it's interesting that you said with parents, you didn't choose, God matched you.
Yes.
And that was exactly the reason I decided to forgive my mother,
Thank you.
because I thought there must have been a reason I came through her.
Yeah.
Um, other than, Buddhist philosophy, I'm also deep into Yoruba philosophy. And Yoruba philosophy teaches us that the Ori we brought to earth already knows what we're going to become and will bring us in contact with the people who will help us be that. And so I believe that, yes, that's part of the reason I came through her, to fulfill a purpose in my life. And I'm still shielding others from her. Even though she's old, she's still the same old person. And I'm still having to shield others from her. Okay, me and my siblings were older, we don't depend on her anymore. Nobody depends on her, but the neighborhood. I still have to. There was a time she went and brought a child from Ijebu to live with her. I said, absolutely not. No underage is going to live with you. I will pay for a domestic servant to help you around the house, but it has to be an adult. I will not allow a child to live with you. And that's exactly what I did. I got her somebody to be her domestic help, an older woman, but no child. Absolutely not.
You've made your peace, and that's
Mhm.
what I was able to make,
Mhm.
at some point. And it's very important. That's why you standing tall and standing strong. The love of a mother is special, yes. But you know what? God also knows what you can handle, and He knows that you can handle it. You may not be able to handle an abusive husband.
Oh, I
As
go kill him.
he gave you an amazing man, but He knows you can handle the mother. God knows what each of us can handle. He will not give us more than we can handle. And so thank you for forgiving her, because when you do that, you free yourself. When somebody bears unforgiveness in their hearts, they allow that person they didn't forgive to live rent free in their brain. They are the ones hurting. And so thank you. You're going to continue to thrive, by the grace of God. Obalende Suya and those body creams that heal all sorts of stuff in the body, as well as the scalp. Thank you for my scalp ointments and stuff that you gave me. Look at who the Lord had made you. You saw me in California, the little piece of my scalp that was showing, you recognized that there's something wrong with my scalp and needs healing, that the hair was too dry. And it's true. And what did you do? You mailed me what I needed because you make it yourself. Look at that skill. You're a professor, a doctor. However, you have all of these other skills. And look at your heart, despite the mother, despite the abuse, despite the pain. See who you had become. Such a blessing to all of us. I thank you. I thank you for my hair push-on.
I'm glad it's working for you.
It's working, no. In
Sorry,
fact,
Doctor. Oh, I was so engrossed in the suya that I did not pay attention to the hair stuff. I think you have inspired me to contact Dr. Ogunleye. I've been so suya. I'm like, oh my gosh.
it's not
Yes,
just suya.
I will
You know,
definitely follow up for my hair. Oh,
makes
it's
the
there,
best
but I
suya.
never paid attention. Suya. Okay, Eshi.
Makes the best suya. It's on the website, and the hair um
It's
hair
great.
stuff as well as the skin. Please post that website on the forum again, please.
Okay, ma'am.
Want to
Thank,
also,
thank you.
our speaker tonight, said something. I had to write it down because this one I have to, just keep in my heart. She said, I am allowed to heal in my own pace, and we all are. She said, I choose to start. We are the ones who would decide that we need the healing to start. And then the healing will take place. I encourage anyone on this platform today who needs to heal to please allow the healing to start.
And so shall it be in Jesus' name.
Amen. Amen. And I want to say also, look at this platform. We had Councillor Aramide Adedeji speak to us from the heart tonight. See what she is doing to give back. She's counseling, she's written a book that will help others. She started a YouTube channel to help others. It's not about her. It's about helping others now to heal. That's when I know that indeed this person is healed or in the process of getting completely healed. Look at Dr. Ogunleye that we just talked about. What about Nkechi, who bought ticket with her credit card to go to Nigeria to go stop the killings of those young ones in Oshodi? They formed gangs and they were killing themselves. We just met her a year ago. She was a wreck when we met her. And within the year, not quite a year yet, she left everything and went to Lagos to go stop this. And even now, is trying to position these young ones to get skilled, to get trained so that they can be gainfully employed and they can stop truancy, they can stop looting, stealing, armed robbery, killing. She had partnered with the army to do this. The cost to train almost 400 young men and women is $7,900,000 and something dollars, which translates to 5,000. I think it's $5,300 or 200 and something dollars. Somebody who is unknown, don't want their name out there, has donated $1,000 to this course. Please donate to help these young men in Mushi so that we can have a safer Lagos. What Nkechi went to do is incredible. Our governor in Lagos could not do it. People in power could not do it because these kids will not listen. But somehow, some way, the Lord used her to listen. Your donation will be tax deductible. And I'll put the link in the platform. God help me remember what it is. I'll put it on the platform. On the platform, Pure Joy said, thank you for sharing, Aramide. Dr. Amy says, thank you for your transparency. And people are subscribing. Pure Joy says she wears the big ruby as her marriage to Jesus. Wow, I love that. And people are subscribing. The link is posted for the hair and skin butters. I will, you know what? I will send, let me write the link. I think is So please donate if you can. It's not by force, so but if you can, to the cause of these guys in Mushin, that would be great. I just posted the link to donate by Zelle. Any questions, comments? Okay. If there are no comments, no questions, we will call it a day until we meet next week. Please stay safe.